Hormones play a major role in everything from our energy levels and mood to sleep, weight, and focus. But when they're out of balance, the effects can be wide-ranging and hard to pinpoint. So to help us understand how hormone imbalances are diagnosed and what signs you should never ignore is Dr. Mark Opperman from the T Clinic. Now, Mark, what is the difference between hormone optimization and hormone replacement therapy?
Michael, I think for a lot of people it's actually a matter of semantics. For me, there's a clear distinction. If we do not produce hormones, for instance in menopause, or if we've had surgery to remove the thyroid for whatever reason, you need replacement therapy because the body can't make it anymore.
Right.
Optimization is when there's not enough or the balance is disturbed. And I often see this in men where testosterone levels have declined. They're still in the normal range, barely. But they're feeling all the signs and symptoms. We also see this for women, for instance, in the perimenopausal period, where there's still hormones, but they fluctuate so wildly that we need to stabilize them. Then I'd like to refer to optimization.
Okay. Now, when we are supplementing, if I can call it that, or replacing hormones, are these bioidentical hormones or are they synthetic hormones? And is there a better option in the two?
You know what, Michael, I think it depends on who you ask, but the data, the studies have shown that there's no difference between the bioidentical hormones and synthetic hormones in as far as safety or efficacy. There might be a difference in side effect profile, where it's said that bioidentical hormones may lead to less side effects. But they're just as effective, they're just as safe as synthetic hormones. Bioidentical is just the chemical structure is exactly the same as, or closer to the same as the natural molecular structure that you will produce in your body than a synthetic one.
Right. Now, Mark, there are some other myths around hormone replacement therapy in terms of safety, what it does to you, how it can impact you. Do you want to sort of debunk some of these myths and maybe let us know what is really going on?
Michael, I think, again, when we hear the word hormones, most people think about treatment for menopause. And there's always been a little bit of controversy over this. In the last couple of years, there's been more clarity. So the myths, hormone replacement therapy will cause cancer. No. Hormone replacement therapy can change your risk for developing cancer.
Right.
So, simple equation. When I get in the car and I drive to the shops, there's a risk that I might be in an accident. If I change the environment, the driving conditions, the risk change. So that's one thing that we need to understand. One of the latest studies that has just been published was in the Journal of American Medical Association. And it said that the benefit of hormone replacement therapy far outweigh the possible risk of something like breast cancer or blood clots.
Right.
We need to understand when there's a decline in hormones, your risk for developing conditions like diabetes, Parkinson's, Alzheimer's, cardiovascular disease, heart attacks, strokes, osteoporosis far outweigh the possible risk of you for having breast cancer. I think one of the breakthrough studies that was misinterpreted many years ago, and we're going back to 2004, was the Women's Health Initiative study, where it proved that there is an association with breast cancer and a combination of estrogen, progestin, and that's where the confusion came in. Progestin is a synthetic form of progesterone.
Right.
And the study was only done on progestin. It was not done on progesterone. So, and there was an elevation, but that study also found that women were diagnosed earlier, they had a better outcome, and what we need to say specifically when it comes to safety is women who have never had any kind of hormone replacement therapy also develop breast cancer. If we take a look at numbers, 10,000 women, 26 no hormones ever will develop breast cancer. If we take a look at 10,000 women with hormone replacement therapy or are taking hormone replacement therapy, it's 35. So it's 9 in 10,000. So it's 0.01%. But the risk of not taking hormones sometimes are worse, on cognitive decline, bone loss, muscle, and then cardiovascular specifically.
So I suppose that goes to the idea of being informed as you can be to know the choices that you're making, but also to what we mentioned in our previous discussion about your medical history, your family history, things like that as well.
Absolutely. Michael, as long as you go to someone that know what they are doing, and most practitioners should be able to guide you on this, we understand your medical history, and you do regular follow-ups. It's not blood tests. Here we're thinking of, but before you embark on this journey, understand what's happening, for instance, with your breasts, what's happening with your uterus. For men, it was always thought that testosterone can cause prostate cancer. It's absolutely been disproven. Testosterone does not cause prostate cancer. It's actually low testosterone that is associated with a high-grade prostate cancer. But what you need to understand is you cannot use testosterone if you have prostate cancer. So we need to make sure that it's safe before we walk onto the battlefield. If there's mines there, you need to know where they are. Otherwise, you might step on one.
Exactly. Now, Mark, treatment, we mentioned some of the treatment options available last time, but obviously this again goes to a big picture. This is not a one-size-fits-all treatment based on it's this, or this, right? So let us understand how you would approach treatment protocol.
Michael, again, here, I can talk about this for hours because we need to break it down. Is this a woman still in her reproductive years going into perimenopause? Does she have a uterus? Does she not have a uterus? Simple to say, there's a treatment for every single individual. Whether it is an oral medication or combination medication, whether it's transdermal, whether it's an injectable, whether it's an implant. Do we do it cyclical? Do we do it continuous? That really depends on the condition that you have, your medical history, family history, risk factors, and therefore you need to go to someone that actually understands you. This takes time to convey your response to treatment to the practitioner. In my practice, I have a whole team of people that work with me, and we're able to follow up with our patients every week or every 2 weeks, and at least once a month. But most people don't have that ability. The patient will tell you how it changed. I use the analogy of a cake. There's a recipe, it's not working for you, so I bake the cake, you taste it, and you tell me what to change. So it's involved where the patient is actually in control.
Okay. Now, briefly, because we're running out of time, but I do want to ask the question around lifestyle factors and how they support the replacement or the optimization part of the hormones, and how important it is that people actually engage with these shifts to benefit themselves in this process.
Michael, I think lifestyle changes, we need to take a look at stress and we need to take a look at sleep.
Right.
You need to be active and you need to have a good diet. Stress and sleep, if it's not optimal, you're going to create hormone imbalances through cortisol. You're going to push up your blood pressure. You're going to get obesity, and that will dysregulate other hormone systems. Same with sleep. If you wake up in the morning, you're not refreshed, why? Are you snoring? Do you have apnea, etc., etc.? And physical activity, 150 minutes per week of moderate to strenuous exercise for adults. Children, at 120 minutes per day. And we're not getting that, and that's dysregulating hormone systems.
So Mark, is somebody sitting there thinking, oh, I'm feeling a bit off, maybe I need to get my hormones checked, I need to consult with somebody. How can they get hold of you? Remind us once again.
Michael, the easiest get hold of us at the T Clinic on 010-824-1393. We're here in Bryanston, Johannesburg, but we consult with people all over South Africa, actually all over the world. Our website, www.tclinic.com, or get hold of us on social media.
Wonderful, Mark. Thank you so much. Some great insights as always. Thank you for joining us.